Group 12, and we'll be presenting about metronidazole. Alright, what is metronidazole? Metronidazole is a widely used antibiotic and antiprotozoal medication. It is effective against a variety of infections caused by anaerobic bacteria that thrive without oxygen, and certain parasites. Alright, let's move to the nursing care. In this slide, we will discuss about the nursing care assessment before administering metronidazole. The first one is we have to always check if the patient have the history of hypersensitivity to metronidazole to avoid any allergic reaction. The second one is we have to assess the patient's vital signs such as temperature to monitor for any signs of infection, and we have to review lab results, especially renal function tests and white blood cell counts to identify any underlying issues. And if the patient is of childbearing age, verify their pregnancy status, as metronidazole use may have risk during certain stage of pregnancy. And the last one, we have to identify concurrent medication like warfarin to avoid any potential interaction, because the warfarin and metronidazole cannot be consumed together. Now let's move on to the nursing care for route-specific administration of metronidazole. The first one is oral administration. As a healthcare provider, please advise the patient to take the medication with food or milk to reduce gastrointestinal upset, and instruct them to avoid crushing or chewing extended-release tablet, as it can affect the drug effectiveness. The second one is topical and vaginal administration. As a healthcare provider, please ensure that the patient understands how to apply creams or gels correctly, and educate them to avoid sexual intercourse while using vaginal preparation during treatment. The last one is intravenous administration. Dilute the metronidazole according to the recommended guidelines and administer the IV infusion slowly over 30 to 60 minutes to reduce the risk of side effects, and regularly inspect the IV site for any signs of irritation or phlebitis to prevent complication. By tailoring the administration route to the patient's needs, we can ensure the safe and effective delivery of metronidazole. Next, let's talk about monitoring during metronidazole treatment. As for the side effect, be vigilant for common adverse effects such as nausea, vomiting, or headache, and monitor for more serious effects like signs of neurotoxicity, which may present as numbness and seizure. And also keep an eye out for allergic reactions such as itching or swelling. And for the second one is liver function. For patients on prolonged treatment, regularly check their liver enzyme levels, and this is particularly important for those with pre-existing liver impairment, as they may be more susceptible to complication. And ongoing monitoring ensure that we can promptly address any issues and support the patient's overall well-being during the treatment. And the last one will be focusing on dietary advice, timing of medication, and managing side effects of metronidazole. For the dietary advice, the patient should be encouraged to drink more water to stay hydrated, as this supports the body recovery and help reduce potential side effects. And if the patient experiences like nausea, advise them to avoid food that might upset their stomach, and a bland diet can be helpful in such situation. The second one is timing. Please emphasize the importance of taking metronidazole at the prescribed times to maintain the consistent drug level in the body, and this will improve the medication effectiveness in treating the infection. And the last one is the side effect. Please educate the patient about the common side effect of metronidazole, such as the metallic taste in the mouth and dark color urine, and please reassure them that these side effects are generally harmless and should not cause alarm. And by providing clear and supportive patient education, we can ensure a better adherence to the treatment and help the patient to manage any discomfort effectively.
I will talk about pharmacokinetics of metronidazole. So I will explain about how this drug will be absorbed, distributed, metabolized, and also excreted in the body. So first of all, absorption. So the route of administration of this drug is by oral, intravenous, rectal, intravaginal, and also typical. Common route is by oral. Its bioavailability comparable between oral and intravenous routes is between 80%. It means how the amount will be reached to the bloodstream. And what if we consume food while taking this drug? Actually, it's not effect at all, because the drug absorption amount remain unchanged, but it can lower Metronidazole Cmax. Cmax is peak plasma concentration. Cmax of metronidazole is 8 to 30 after a standard dose. It can be various factors to like different Cmax, which is dosage because of food and also because of absorption rate. Its Tmax, which is time to peak concentration, is 25 minutes to 4 hours. Next one is by distribution. Metronidazole volume of distribution around 0.5 to 1 liter per kilogram, which is it means that this drug can be widely spread throughout the body. So wide distribution to central nervous system, liver and other body fluids, and it can be CSF penetration, which the drug have ability to cross BBB, which is made that this drug is more effective in infection in the brains and also spinal cord. Next one is protein binding. It have minimal protein binding around 20%. It means that minimal drug interaction. The third one is metabolism. So primary site of metronidazole metabolism is by liver. So it's involved an enzyme like cytochrome P450 system, which is it can have inducer, which is for example, phenobarbital, prednisolone, rifampin, and also possibly ethanol. This inducer can enhance metronidazole metabolism, while it inhibitor, which is can slow metronidazole metabolism. Example like cimetidine. Metabolites divide into two, which is active. It means that drug is remains original therapeutic effect, while inactive metabolites it lost its therapeutic effect and typically it will be eliminated from the body. For example of active metabolites is hydroxymetronidazole, which is a major one. Major metabolites is mean that most abundant metabolite that were produced. One example of inactive metabolites is acid metabolite and also gluconide conjugates. So the last one is excretion, which is the main route is in urine, which is around 77%, and feces, which is around 14%. The urine will be a discoloration, with some patient will be exhibit reddish brown urine due to the pigment that derived from the drug. Next is metronidazole half-life, which is around 8 to 13 hours. Half-life is parameter to reflect how quick the drug will be eliminated from the body. Its clearance is 10 to 20 liter per hour. Affects how combination of the effect hepatic metabolism and also renal excretion. So these both influence how quickly the drug will be eliminated from the body. Clearance is very crucial to determine how appropriate the dose, especially in patients with impaired liver or kidney function.
So next, we are going to talk about pharmacodynamics. Okay, pharmacodynamics is actually how the drug works with our body to produce its therapeutic effects. Okay, so the mechanism of action, the first one is metabolite activation by anaerobic bacteria, for example, Trichomonas vaginalis. Okay, so what happened is metronidazole is actually a prodrug, so it need to be activated by anaerobic bacteria. Okay, so what happened? Trichomonas vaginalis will reduce the nitro group in metronidazole, so it will activate the metronidazole. The next mechanism of action is by DNA damage. Okay, what happened is when metronidazole is activated, the metabolite will bind with microbial DNA. What happened is the DNA will be break, so it will cause inhibition of DNA synthesis. Okay, so it will cause bactericidal effect and also protozoicidal effect. Okay, protozoicidal effect is when the metronidazole kill protozoa through breaking down the DNA. And however, for bactericidal effect, what happened is the killing process of bacteria that happen through damaging the DNA. So the last mechanism of action is selective toxicity. Okay, so metronidazole is actually only toxic to anaerobic microorganism. When human cells are exposed to metronidazole, there is minimal harm that can occur to human because there is no reduction process occur. Okay, so why? Because our human cells are primarily aerobic, so it will cause minimal toxic to human cell. Metronidazole will cause certain effect to our gut microbiota. For example, it will kill anaerobic bacteria, reduce diversity, which is lower the diversity of gut microbiota, and last one is increase pathogen risk. So next, adverse reaction that can occur is GI disturbance, urticaria, angioedema, drowsiness, dizziness, headache, skin rashes, and also darkening of uterine.
So now I'm going to talk about the example of metronidazole, which is flagyl. So the first one is I'm going to talk about the drug groups of flagyl. It has two drug groups. The first one is metronidazole antibiotic, which will be used to treat infection caused by anaerobic bacteria and some protozoa. Metronidazole antibiotic will only be activated against anaerobic organism and some protozoa. It also have low resistance, but it may occur due to the reduced activation. Next, the second group is the antiprotozoal. It will treat the infection caused by protozoa, and it will prevent protozoa from reproducing by blocking the DNA synthesis. So next is I'm going to tell a little bit about the dosage. The first, it has 4 ways to take flagyl. The first one is suppository, tablet, suspension, and injection. So for suppository, the dosage for kids will be between 125 and 500 milligram, will be taken every 8 hours. And for adult is 1 gram rectally, also every 8 hours. The next one is tablet. Child will be taking dosage 7.5 milligram per kilogram for every 8 hours, while adult will be take 800 milligram and will be followed by 400 milligram. Next one is suspension. For child, they will take the same one as tablet, which is 7.5 milligram per kilogram for 7 days. And for lastly, for injection, it will be given intravenously. For kids is 7.5 milligram per kilogram, and for adults is 500 milligram. So next is the therapeutic effect of first one. It will treat anaerobic bacteria and some protozoal infection. It also had effective in eliminating Trichomonas vaginalis, Giardia lamblia, and Entamoeba histolytica. Next is this drug will also reduce symptoms like diarrhea, abdominal pain, vaginal discharge, which associated with protozoal infection. And lastly, it can also reduce complication risk, like assist in prevent the development of abscess, systemic infection, or chronic symptom. So although this drug is very good, it also have some side effects, which is bad taste, nausea, abdominal discomfort, vomiting, and itching. It will also have some adverse effect, which is mild central nervous system effect and serious central nervous system effect. So the last one, I'm going to talk about the contraindication of flagyl. People who are pregnant women in their first trimester should avoid this drug. Other than that, people who are alcohol dependent and products that contain propylene glycol should be avoided. That's it. Thank you.
Today, I want to share health teaching for patients. For general instruction, you have to complete the course. Take the full course of the medication, even you feel better before finishing it. You have finished the course to ensure complete eradication of the infection. Then, take the medication as prescribed at evenly spaced interval to maintain consistent drug level in the body. Second is route-specific instruction. For oral tablet or capsule, you can take with food or milk to minimize stomach upset. And for vaginal gel, apply at bedtime to reduce leakage. And last, for topical gel, apply a thin layer to the affected area and wash hand after application. And then, if a dose is missed, take it as soon as you remember. If it is almost time for the next dose, skip the missed dose, do not double up. And last but not least, do not consume alcohol during treatment and for 48 hours after the last dose. It may cause a reaction like nausea, flushing, and vomiting. For side effect, you common may experience is nausea, diarrhea, or metallic taste in your mouth. They are typical mild and may resolve with continued use. And then you have to notify your provider if you experience persistent headache, dizziness, or numbness in your hand or face. or you develop a rash, itching, or difficulty breathing, is possible sign of an allergic reaction. And then you notice seizure or severe neurological change. For diet, you recommended to eat light and no irritating food if nausea occur. For example, is cracker, toast, or bland diets may help. And then you have to stay well hydrated by drinking plenty of fluid, especially water. And the important is you have to avoid alcoholic beverage during and after treatment, like 48 hours post treatment. And then you have to avoid highly fatty or spicy food, which may worsen gastrointestinal discomfort.